Why, hello. Happy Thursday. No stream key. Let's go ahead and get started or get the intro started. Hello, everyone. As you are coming in, please make a comment so I can see who's all here. All right, let's add Insta to the mix. Stream key. Okay, cool. All right. All right. If you can see and hear me, give me a thumbs up. Wait. Okay, now. All right. Hello, everyone. Okay. As you guys are coming in, hello, happy Thursday. It's NCLEX Jeopardy Day. As you guys are coming in, please let me know if you guys can hear me and see me. Give me a thumbs up or just tell me yes. Drop something in the comments so I know that you can see and hear me. So we can get the ball rolling. Welcome, everyone. Hopefully you can hear me before I get started, actually. Okay, mic's on. Here. Great. Okay, perfect. What about you guys? Okay, great. You guys can hear me. Awesome. Hello and welcome. Welcome to NCLEX Jeopardy Thursdays. We do this here on my YouTube channel every Thursday. And we're going to do it for about an hour. If you guys have never played NCLEX Jeopardy, please let me know below. I'm going to give you guys a quick little intro. I'm Nurse Sam. I'm your host and creator of NCLEX Jeopardy. I created NCLEX Jeopardy in 2020 when we needed like a very fun, at the time, the world was going through what it was going through. We needed a very fun NCLEX review or a way to digitally and virtually practice our NCLEX reviews. So I created something that's very fun, very gamified. I love a good gamified review to help out. And from then we just continued on, and here we are 2026. So we're bringing this back. So how we're going to play is in true Jeopardy style. Okay. We're going to have 5 categories, and in each of the 5 categories, you're going to have 5 questions. Now, our categories are going to be those main topics that you're definitely going to be tested on the NCLEX, and those main hitters when it comes to nursing school NCLEX prep. Pharmacology, fundamentals, maternity, mental health, med-surg. Those are like the main 5. Then you have like, pediatrics, dosage calculations. And in some weeks, those categories are going to switch. Like pharmacology will sometimes switch with dosage calc. Maternity will sometimes switch with pediatrics. But for this week, our topics, as you can see, right here: pharmacology, fundamentals, maternity, mental health, and adult health, which is going to be our med-surg. 5 questions per category. I'm going to select a question. It's going to come up. You're going to see the question, the answer choices. You're going to answer them. How are you going to answer them, though? Because this is Jeopardy, NCLEX Jeopardy. We're going to do it Jeopardy style. You got to say what is. Okay? You have to say what is if you want the points. Okay? We're, of course, playing for points because I love a good gamified review, like I said. Everyone loves a good incentive. And the incentive is going to be whoever has the highest amount of points at the end of the game is going to win a free, complete nursing school study system, which includes everything that I have on our website, thenursesam.com, that I've ever created in the past 6 years. All that, plus some things that you aren't even privy to that's maybe in camp nursing school, some stuff just exclusive to that bundle, that system. You're going to win that. So Well, if you want to play for points, when you're answering the questions, say what is. If you just want to answer the question as a review, you can just answer, of course. And we're going to go over the rationale, how to answer it, and most importantly, how to break it down. Okay, so this isn't just a regular review. We're not just answering questions and moving on. I'm really going to help you train your brain on how to answer NCLEX style questions, how to think like the NCLEX wants you to think in order to answer and decode these questions. Okay, so if you guys are ready and prepared to get started, give me a thumbs up in the comments and let me know what category and number you want to start with. And I'll choose from your selections, okay? Hello, everyone. Hello, everyone that's just now coming in. Welcome. This is NCLEX Jeopardy. We're about to get started. If you have any questions on how we play, just let me know. Drop a question or in the comments below, but we're going to go ahead and get started right after you guys let me know what category and question number you want to start with, okay? And as we play, you're going to catch on to how the rest of the night is going to go. All right. Hey, Bovana. All right, so I have our scoreboard here. Remember, we are playing for points, okay? So the first person to answer correctly and answer in that what is style is going to be the person that wins the points, okay? All right, so I'm seeking adult health 100, but Bovana did funds for 100 first. So we're going to do funds for 100 points. All right, this is NCLEX Jeopardy. I'm your host, Nurse Sam. Make sure to like this video, follow, subscribe for more. We do this every Thursday. All right, fundamentals for 100. The nurse is working at a Veterans Affairs clinic that provides services for homeless veterans. Which client should the nurse attend to first? 1, a client with a persistent cough. 2, a client with a plan to harm himself. 3, an amputee with an infected wound. 4, a client with a history of substance abuse. Let me see what your answers are. All right, I'm seeing what is 2. What is 2? Everyone's saying what is 2, which is a client with a plan to harm himself. Let's see what our answer is. And the answer is what is 2. Great job. Awesome. What is 2? First person to get that was Ramneek. Hello, Ramneek. Welcome, welcome back. All right, so Ramneek is on the scoreboard with 100 points. You guys remember this can be anyone's game. We still have a lot of questions to go. Let's go over the rationale and break this down. All right, so mental health is common amongst veterans. PTSD or post-traumatic stress disorder is one of the most prevalent problems and can easily lead to suicide, which occurs commonly in this population. This, and then it says a client with a plan to harm himself or others is a safety risk and should be assessed or addressed first. That was the content side of it. The whole PTSD, one of the most prevalent problems, very prevalent and common amongst veterans. That's the content side of what you need to know in order to answer this question. The strategy side, as you can see here, which client should the nurse attend to first? This is a priority question. Wait, let me move my head, see if you can see better. Wait, oh no. Okay, great. But yeah, strategy question. First, this is a priority question. The fact that it's a plan to harm himself, whenever you see a question or an answer choice that has anything to do with suicide, unaliving, well, that's the same thing. Suicide, harm, whether that's harm to themselves, harm to you, harm to other people, that's a safety issue. Safety is priority. Remember Maslow's, that's what you have to think about when you are doing priority questions. Safety is first, client safety is prevalent. So whenever you see that, your eye should instantly dart to that. So that was the content and the strategy behind that. Great job. All right. Now let's do another question. Let's do adult health for 100 because I thought someone would say that next. The nurse is assessing the client's level of consciousness and documents that the client has delirium. On the basis of this documentation, the nurse should determine that there is damage to which area of the nervous system. 1, temporal and frontal lobe. 2, hippocampus and frontal lobe. 3, limbic system and cerebral hemispheres. Or 4, reticular activating system and cerebral hemispheres. For those that are in nursing, camp nursing school, y'all better not get this wrong. Let's see what our answers are. All right, I'm seeing what is 1. I'm seeing what is 1. Again, I see what is 3. Tell me why. This is one of those questions where I need to know why. What makes you say that? What makes you pick your answer? What about the question makes you say, okay, it's temporal and frontal lobe? And then for those that say 3, limbic system and cerebral hemispheres. Answer that, type that in the comments while I answer this question. I'm gonna give you guys a couple more seconds and then I'll reveal the answer while you guys tell me why you chose your answers, okay? Let's see who's correct. In 3, 2, 1. The answer is actually what it's for. Reticular activating system and cerebral hemispheres. That was a good one. No one got that, but that's okay. Because now we're going to go over it. So if you see this again, you won't get it wrong. Okay. So insomnia, agitation, mania, delirium, those are caused by excessive arousal of the reticular activating system in conjunction with the cerebral hemispheres. The temporal lobe, hippocampus, and frontal lobe, those are responsible primarily for like memory. And the limbic system is responsible for feelings and affect. Who was I talking to about the limbic system? And we were talking about feelings, how to remember that the limbic system is for feelings and affect. You know, when you're in a situationship and you feel like you're in limbo, you feel like you're in limbo in the limbic system for feelings and affect. That's how I remember it. That's how I'm gonna take it if you want or leave it. There you go. Okay. And then temporal lobe, frontal lobe, hippocampus, their functions are for other things as well, but in this case, it's for memory. Okay, so it is for reticular activating system. Okay. Shania, I see you said 3, not 4. All right, let's get into. I thought about limbo. Yes, it was you, Shania. It was you, Shania. Yes. Okay. All right. Now let's do pharmacology. Let's do pharmacology. Let's do for 200. Let's up the ante a little bit. All right. A client with diabetes mellitus, this is good. Self-administering NPH insulin from a vial that is kept at room temperature. The client asked the nurse about the length of time and a refrigerated vial of insulin will maintain its potency. What is the most appropriate response to the client? 2 weeks, 1 month, 2 months, or 6 months? What is our answer? For those that are in camp nursing school, are not this Tuesday, but last Tuesday, our nursing school Q&A sessions that we have, like our office hours that we have for support. Somebody came in and wanted to go over insulin types, and this is what we went over. So let me see what you guys are saying. What is 2? What is 2? What is 2? Which is 1 month. Let's see what the answer is. It is what is 2. Great job. First person to get that. On this side was Bovana. Great job, Bovana. Welcome back and welcome to the scoreboard. Bovana. Awesome, awesome. All right, so Bovana, you have 200 points and you are now in the lead, okay? All right, so an insulin vial in current use can be kept at room temperature for up to 1 month without significant loss of activity. Direct sunlight and heat must be avoided, okay? Great job, though. All you guys got that? Perfect. Let's do another one. I'm gonna let you guys pick this next category. So go ahead and drop in the comments what category you want me to do next. Okay. I hope you guys are enjoying this so far. Remember to like this video, like this live, so I know that you guys are learning something, you are enjoying this, so I can do more of it. And remember, we do NCLEX Jeopardy every Thursday right here on my YouTube Live at 7 p.m. Eastern Standard. All right, so mental health for 200, and then we'll do adult health for 400 next. All right, so mental health 200. Which client behavior demonstrates denial of sexual abuse event? 1, pacing while mumbling profanities. 2, minimizing the severity of the event. 3, being confused about the details of the event. Or 4, sitting quietly and calmly reading a magazine. Which client behavior demonstrates denial of sexual abuse event? Sarah said, I brought your collective nursing study last week. Yay, the complete nursing school study system. I really hope it's helping you. All right, let me see what you guys are saying. I see what is 3 on this side. I see what is 2 on the YouTube side. Instagram is saying what is 3 though. All right, so we're between what, 2 and 3. So 2 is minimizing the severity of the event. And 3 is being confused about the details of the event. Okay, remember, we're trying to figure out which client behavior demonstrates denial of sexual abuse event. So let's see what our answer is. It's 4. Sitting quietly and calmly reading a magazine. It is 4. All right, so let's break this down, mental health style. Okay, so denial is a response by a victim of sexual abuse. I mean, not solely by a victim of sexual abuse, but okay. It is described as an adaptive and protective reaction and may be identified by a calm and quiet behavior in the client. And then it says the remaining options are all some recognition that the event actually occurred. So denial was the key word. Shout out to you, Renee. Denial was the key word. If you guys are not familiar with me, I specifically teach you guys how to identify the clue or the descriptive word in the question, because if you don't know the content, strategy will save you every time. Okay, and there are certain words, terms, phrases that the NCLEX loves to use that you need to familiarize yourself with, because when you identify them in the question, you can't unsee it. Okay, and everyone that I've had one-on-ones with, all my camp nursing school people can attest to this. They know what I'm saying. All right, so denial was the key word here, sitting quietly and calmly reading a magazine. Now let's go to adult health for 400. No one got that one, but that's okay, because now you know. Remember to identify the clue in the word. Okay, where is the descriptive word or the operative word here? So this is a adult health for 400. Let's break this one down. The nurse monitors the respiratory status of the client being treated for acute exacerbation of chronic obstructive pulmonary disease, aka COPD, because who got time to say all that? Anyway, which assessment finding would indicate deterioration in ventilation? What's the key word here? Okay. 1, cyanosis. 2, hyperinflated chest. 3, rapid shallow respirations. 4, coarse crackles auscultated bilaterally. Camp nursing school people. When we did our respiratory thing, we went over this. Okay. All right. Let me see what you guys are saying. I see 3s and I see 1s. 1 is cyanosis, which means what, by the way? Quick comprehension check. Cyanosis means what? And then 3, rapid shallow respirations. Okay. Let's see what our answer is. It is 3. Great job. Rapid shallow respirations. All right. Let's look at our client. Our client is being treated for acute exacerbation of COPD. Okay. And yes, cyanosis means blue discoloration due to low oxygen perfusion. All right. So that's our client. They're having a flare-up of COPD. We're trying to find the assessment finding that would indicate deterioration, all right, of that ventilation. And the answer was yes, rapid shallow breaths, because that increase rate of respirations and that decrease in depth of the respirations together indicate that deterioration of ventilation. Okay. Now that cyanosis, that's not a good indicator for those that said one. It's not a good indicator of oxygenation in the client with COPD because it may be present in some clients, but not all. All right. So it's one of those that's not like a hallmark symptom of COPD. It's a symptom of the fact that there's low oxygen perfusion. Okay. But great job. First person to get that was Shay Kelly. Shay Kelly 5747 on YouTube. Congrats. You are now on the scoreboard with 400 points. You see what I mean when I say it can be anyone's game? That's exactly what I mean. So you are now on the scoreboard with 400 points. Congrats. Great job. Great job to everyone that got it right. And please remember that even though you may not answer the question first, you are just as long as you are getting it correct, you're still doing what you need to do. All right, this is just the gamified version of the NCLEX review, but you need to be getting it right, or at least understanding why you're getting them wrong if you are getting them wrong. That's the whole purpose of a good and effective review. Okay. All right. Let's do some fundamentals of maternity. Let's do maternity. No, let's do fundamentals first, and then we'll do maternity. All right, let's do 300 for fundamentals. 300 for fundamentals. For everyone that's just now coming in, welcome. This is NCLEX Jeopardy, our gamified review. We are just about to do fundamentals for 300 points. Shay Kelly is in the lead with 400 points. And let's break this question down. A clinic nurse is providing instructions to a client who is scheduled for a glucose tolerance test. Which instruction should the nurse provide to the client in preparation for the test? Eat a normal breakfast on the day of the test. Take insulin as scheduled on the day of the test. Eat a low carbohydrate diet for at least 3 days before the test. Or avoid alcohol, coffee, and tea for 36 hours before and during the test. What is our answer? I'm immediately seeing you guys answer. I see what is for. It looks like everyone is saying what is for. Looks like everyone is saying what is for, which is eat a low carb diet for at least 3 days before the test. No, I'm sorry. That's 3. Avoid alcohol, coffee, and tea for 36 hours before and during the test. Let's see what our answer is. And it's exactly that. Great job. Great job. First person to answer that, though, was Shay Kelly. Great job, Shay. You're already on the scoreboard with 400 points. This was 300, so you now have 700 points. Great job. And great job to everyone that answered. You got it correct. Now, let's break down what this is and the rationale. It says fasting is required from midnight before the test until the test is completed, although water is permitted. Okay. Now, the client is told to discontinue insulin or oral hypoglycemic agents on the day of the test. Do you know why? Do you understand the logic behind discontinuing the insulin and oral hypoglycemic agents during fasting, during the day of the test? Do you understand why? If so, please let me know in the comments. I'm going to continue on. The nurse instructs the client to consume a high carb diet, okay, at least 200, 300 grams of carbs per day for at least 3 days before the test, and to discontinue oral contraceptives, corticosteroids, salicylates, and thiazide derivatives 3 days before the test. Okay, and that's so it does not invalidate the results. Okay. Good job. I told who the first person is. Now let's do maternity. Y'all have been avoiding maternity. Let's go ahead and do maternity. Let's do. Okay, yeah. Let's do maternity for 100. The nurse is providing instructions to a pregnant client with a history of cardiac disease regarding appropriate dietary measures. Which statement, if made by the client, indicates an understanding of the information provided by the nurse? 1, I should increase my sodium intake during pregnancy. 2, I should lower my blood volume by limiting my fluids. 3, I should maintain a low-calorie diet to prevent any weight gain. And 4, I should drink adequate fluids and increase my intake of high fiber foods. Speaking of increased water intake. Okay. Let me see. Seeing 4s. Ooh. If the answer is 4, Bovana and Shaquille, y'all were neck and neck. Let's see what the answer is. And it is 4. First person to get that, though, was Bovana. She popped up first. So, Bovana, you're on the scoreboard with 200. This is plus 100. You now have 300. Great job. All right, so the answer is 4. I should drink adequate fluids and increase my intake of high fiber foods. All right, now, why? Because constipation. All right, that's why we want to increase the intake of high fiber foods to manage or prevent constipation. Why? Because constipation can cause the client to use the Valsalva maneuver, and that should be avoided with clients with cardiac disease because it can basically cause the blood to rush to the heart and overload the cardiac system. You can pass out, basically. Your blood pressure drops. You get very woozy, dizzy. You pass out very quickly. Okay, so constipation can be prevented by increasing fluid intake and the intake of high fiber foods. Bonus question, give me an example of a high fiber food. Go ahead. Just give me one. I usually say no at least 3, and you should know at least 3, but for these circumstances, just drop one high fiber food that comes to your mind, just one. Drop that in the comments, okay? A low-calorie diet is not recommended during pregnancy and could be harmful to the fetus. You're not just eating for 1, you're eating for 2, okay? Sodium should be restricted, okay, as prescribed by the primary healthcare provider because excess sodium would cause an overload to the circulating blood volume and contribute to cardiac complications. AKA, remember the fact that water and sodium kind of go together. So if you have excess sodium, you're going to retain lots of fluid. It's going to increase your blood pressure. Sodium and cardiac issues are not good together. They're not good together at all. Diets low in fluid can cause a decrease in blood volume, which could deprive the fetus of nutrients. Once again, remember that this is a pregnant patient. So the actions aren't just affecting the patient. You now have 2 patients, mom, fetus. Okay. All right. Beans, great job. That is very high in fiber. Spinach, fruits, oranges, for example, are high in fiber. Lots of fruits that have the skin on them. The fiber is in the skin a lot of times. And I don't mean like orange peel skin. I mean like an apple. The skin on an apple, that's what I mean by the skin of a fruit, not like peelable fruits. Brown rice. Oatmeal. If you guys have the NCLEX diets study guide, I have a list of high fiber foods in there. I have a list of high and low, insert whatever type of foods here that's commonly asked on the NCLEX. So definitely check that out within the nursing school study guides folder if you have the complete study system, or if you have the ultimate bundle, it's in the beginning. It should be after fundamentals. Okay. All right. So yes, those are great. Let's go to the next one. All right. So again, this is how you break down these questions so you can really make sure you understand what it's asking you. All right. All right. Give me some more, drop some more categories and question numbers that you want to do. We have done at least one question on all the categories on the board. So let me see which category you guys want to do next. Go ahead and drop the category and the number in the comment. Adult health for 500. All right. Oh, this is such a good one. The nurse is monitoring a client diagnosed with acromegaly who was treated with transsphenoidal hypophysectomy and is recovering in the intensive care unit. Which findings should alert the nurse to the presence of possible post-operative complications? Select all that apply. This is so good. 1, anxiety. 2, leukocytosis. 3, Chvostek sign. Are you proud of me for knowing how to pronounce that? I am. 4, urinary output of 800 milliliters per hour. And 5, clear drainage on nasal dripper pad. Select all that apply. This is such a good 500 pointer. Remember, with select all that apply, it can be as little as one of them or as many as all of them. In this case, we have 5. It could be all 5. Okay. All right, let me see what you guys are saying. 2, 3, 4, 2, 3, 5, 4, 5. All right, let's break this down. Okay. Who's our client? What's happening to our client? Always think about the client, the situation, and what the question's actually asking you. And see if you can identify any keywords that you need to know. Okay, and any clues, descriptive words. So our client diagnosed with acromegaly. All right, treated with a transsphenoidal hypophysectomy. Those in Camp Nursing School, y'all know what this is. Okay, drop it in the comments, especially you, Remini. And we just did endocrine, I believe. Drop in the comments what a transsphenoidal hypophysectomy is. All right. So we're looking for the findings that should alert to the presence of a post-op complication. So in order to know what the possible post-op complications are, you need to know what the op is. You need to know what the operation is, which is why I said, hey, do you know what the transsphenoidal hypophysectomy is? Because you need to know what that is. It's very important in order to understand what could possibly go wrong. So with that being said, let's see what our answer is. It's 2, 4, and 5. Did anybody get 2, 4, and 5? No, but a lot of you came really close. 2, 3, 4, 2, 3, 5. A lot of you said 3. Let's go into why. 3 was Chvostek sign, but that's not the answer. It's 2, 4, and 5. 2 is leukocytosis. 4 is urinary output of 800 milliliters. And 5 is clear drainage on nasal dripper pad. Let's break this down. All right. So acromegaly. What is acromegaly? Right? That's when you have an excess secretion or hypersecretion of growth hormone. We can get into that in endocrine. All right. Yes, it's usually caused by a benign tumor of the anterior pituitary gland. Okay. So the fact that what it's caused by and where it is, the pituitary gland, specifically the anterior, note that. All right. Now, treatment of that, though, is the transsphenoidal hypophysectomy, either complete or partial. All right. Now, what that is when they take note, because you will see this again, I promise you. A transsphenoidal hypophysectomy is when there is a tumor, usually, that's removed from the anterior or from the pituitary gland, but the way that they go, the approach that they go is through the nose. Okay, so they go through the sphenoid, we say it's transsphenoidal. All right, that's across. Break that down term-wise. Trans means across, sphenoidal, the sphenoid bone, that's facial, one of the facial skull bones. That's where the pituitary gland sits, that bone right there. So it's going across, that's your sinuses, basically. It's going across your sinus sphenoid bone to get that tumor and take it out. All right. Very important to note that this type of brain surgery is going again through your nasal sinuses and not through your cranium. Okay. There's no craniotomy happening. Just want to let you know. So leukocytosis, elevated white count. That, of course, may indicate infection. Anytime there's a surgery, infection is going to be one of the possible complications. Boom. All right. Now, diabetes insipidus, that's a possible complication of that transsphenoidal hyposphycectomy, because it is the pituitary gland. Think about all the hormones that are secreted and controlled by the pituitary gland. Pretty much all of them. So if something happens to where that is affected in a negative way, that can have a major impact on your hormones. Okay. Diabetes insipidus, there's a decreased secretion of ADH, or antidiuretic hormone. So if you have diabetes insipidus, you're going to excrete large amounts of urine. Okay. The nasal passages that the instrument goes across in order to get the tumor, that's going to be packed, and a dripper pad is secured under the nasals, or the nares, I should say. Now, clear drainage is a suggestive of a CSF, or cerebral spinal fluid leak. That's bad. Okay. Now, notify the physician. That's usually tested for. Does anybody know what CSF is tested for, or that drainage is tested for, in order to test to see if it is CSF? We're testing for the presence of what? Drop in the comments if you know. Oh, never mind. It says it right here. It's glucose. Never mind. It says it here. It's glucose. All right. So Chvostek's disorder sign, those of you that said that, it's not that, because it's a test of nerve hyperexcitability, and that's associated with hypo or low calcemia. All right. That's usually when you tap the cheek. Chvostek, that C for cheek. That's how you know that. That has no association with the complication of this, because hypocalcemia is not an effect or a possible side effect of one of the hormones that's excreted from the pituitary gland. Does that make sense? No, the parathyroid gland is here, right? Your thyroid is here, and then the parathyroid glands is like the little bow shaped. It's the four little glands on the little bow shaped thing on your neck. So if you're going here into your brain across your nasal passages, it's not affecting your parathyroid gland at all. So your calcium, which is usually where you would get that from, that's not being affected. Does that make sense? All right, great job. No one got 2, 4, 5, but a lot of you got 2 out of 3. So great job. Okay. Let's do pharmacology next. And let's do pharm for 500. Okay, that was a good question. All right, next one. This is pharmacology for 500. This is the NCLEX Jeopardy. Okay. All right, so the primary healthcare provider prescribes cromolyn for the client with asthma. Where all my respiratory peeps at. The nurse identifies that the client correctly understands the purpose of this medication when the client states that the medication will produce which effect? 1, promote bronchodilation. 2, decrease the risk of infection. 3, suppress an allergic reaction. Or 4, eliminate the need for a rescue inhaler. What is our answer? Let's go back to what the question's asking and break it down. What's our situation? What's our client? Client has asthma. Situation, prescribed cromolyn. This is a pharmacology question. This is based off of a medication. So obviously, you need to know what that medication does, cromolyn, right? So the question's asking us for what identifies that the client correctly understands the purpose. So what is the purpose of this medication? All right. When the client states that the medication will produce which effect? Okay, so therapeutic effect is by what? I'm seeing 1s and I'm also seeing 4s. 1 is promote bronchodilation. 4 is eliminate the need for a rescue inhaler. Let's see what our answer is. 3. Oh, good job, Shania. Awesome job, Shania. Awesome job. It's 3, suppress an allergic reaction. All right, cromolyn. It is a first-line therapy for prophylactic treatment of asthma. All right, it is. Okay, yeah. It is a mast cell stabilizer, anti-asthmatic, and anti-allergen. The medication acts in part by stabilizing the cytoplasmic membranes of mast cells, thereby preventing release of histamine and other mediators. It is not a bronchodilator. It does not decrease the risk of infection, and it does not eliminate the need for a rescue inhaler. So the answer is 3, suppress an allergic reaction. Great job. Now, Shania, did you know that because you knew the purpose of cromolyn? What's on my lip? Okay. Did you know the use in the purpose of cromolyn, or did you kind of do process of elimination? It's important to note because with pharmacology questions, a lot of times you have to use strategy because they'll use a medication that you may or may not have heard before, and you have to take what you know based off of, the strategy behind maybe the class or other clues in the question to kind of get to your answer, even if it has to have to do with process of elimination. All right. So once again, cromolyn suppresses an allergic reaction. So now you know. Okay. That was a good one. All right. Let's do another fundamentals one. Let's do a little bit both. I do remember hearing of the drug somewhere. Okay, good. Let's do this one. Another select all apply. I love these because the more you practice it, the better you get. All right. The nurse provides instructions to a client. Wait, did I give points? Hold on. Shania, you are now on the scoreboard. That was 500 points. So you now have 500 points. Great job, Shania. All right, back to this one. This is fundamentals for 500. All right. So the nurse provides instruction to a client with low potassium levels about the foods that are high in potassium and tells the client to consume which foods. Select all that apply. 1 peas, 2 raisins, 3 potatoes, 4 cantaloupes, 5 cauliflower, 6 strawberries. As I was reading it, I was like, beans, greens, tomatoes, potatoes, lamb, ram. That's what I was thinking about. But yes, we're looking for the foods that are high in potassium. Okay. Now, this is a good question because if you go too fast, all right, it says right here, the nurse provides instruction to a client with a low potassium level. That's giving you the situation. They have a low potassium level. If you're looking real fast and just stop there, you may think you're looking for foods that are low in potassium. I feel like an old church lady doing this. I'm sorry. But you may think you have to look for foods that are low in potassium, but no, continue reading the whole thing. You have to look for foods that are high. And if you have ever heard me teach, every time we come up with a potassium question or any question that has to do with potassium, I always follow up with the question asking, now name a food that's high in potassium. And I do that for questions just like this. I told you, you'd see it. Okay. So foods that are high in potassium, let me see. I see 3, 4, 1, 2, 3, 4, 2, 3, 6. Let me see. 1 and 3, 2, 3, 4. Two, three, four. Okay. I'll give you guys a couple more seconds. I'm glad none of you are changing your answers. Are ready? In 3, 2, 1. Okay, that was anticlimactic. There we go. 2, 3, 4, and 6. Ooh. Remnick and Shania, you guys got the closest. Remnick, you missed 6. Shania, you missed 4. All right, so 2 is raisins, 3 is potatoes, 4 is cantaloupes, 6 is strawberries. Make sure, I'm so glad somebody said strawberries, because the NCLEX and strawberries, that is such a sleeper. A lot of people instantly think, okay, bananas, and I'm glad they didn't include bananas on here, because that's like the instant thing that you go to, bananas. But strawberries, please remember that strawberries are high in potassium, because the NCLEX loves to throw that in there for foods that are high in potassium, that are fruits specifically that are not banana. You have your avocados, you're gonna have your bananas, obviously, but strawberries is an underrated sleeper. Okay, make sure you know that. This is a perfect example of what I mean by that. All right, so avocados, always know at least 3 other than banana. Please, Jesus. Okay, so avocado, bananas, cantaloupes, that's another good one. Carrots is another good one. Fish, mushrooms, oranges is another good one. Citrus fruits. Think citrus fruits. Yeah. Potatoes, pork, beef, veal, raisins, spinach, strawberries, and tomatoes. Spinach is another sleeper. Okay. Usually people think about vitamin K for spinach only, but you need to think about potassium as well. And then peas and cauliflower, they're high in magnesium. The more you know, right? The more you know. Great job, guys. I just named so many I didn't think. Right, exactly. If you didn't have any of these foods that are high in potassium in your repertoire, please take a minute, screenshot this, do what you need to do, jot it down. So you just have it in your pocket for when you need it, and you're going to need it. Case in point. Okay. Now, next question. All right, we have 13 minutes left. So still can be anyone's game. Where are we now? We have Shay Kelly in the lead with 700 points, then Shania with 500, Bovana with 300, and then Remnick with 100. Okay. Really quick little pause. I just want to check in with you guys to see how you're doing, how you feeling, how you enjoying tonight's game of NCLEX Jeopardy. Are you learning a lot? Are you enjoying this? Let me know how you feel. I just want to check your temperature really quick. Is this not such a fun way to just spend Thursday, an hour on Thursdays? Like, it's fun, but it's also effective studying. Like, you actually have guidance and support. If you want to ask questions, you can. We're actually doing NCLEX questions that you will see again. I promise you will see. But, we're breaking it down. So even if you are getting questions wrong, I was just talking to one of my one-on-ones about this earlier this week. But even if you get questions wrong, think about that. Always put it in the perspective of you now understanding why you got it wrong, so that next time you can apply the correct strategies and the content topics, so you can now get it right. So always think about it as like, oh, may have gotten it wrong in practice, which is that tracks, right? I always say, think about when Beyonce was practicing for, Coachella or whatever, grand concert. Do you think she got everything right and all the steps correct at first? No, she even showed in her documentary. She was messing up at first. But when we see that show and your Coachella is going to be NCLEX, your act 1, 2, and coming up 3, I believe, your concerts are going to be the NCLEX. And so you may be messing up now, but when it's time for the show, 10s across the board, no notes. All right. Now let's do another maternity. Actually, before I do another, let's just do another what's this? Adult health. Let's do another adult health. Let's do, which one do I want to do? Ooh, let's do this one. Is this done regularly? This is my first time joining. Hello, welcome. So this is done regularly. We are doing this every Thursday at 7 p.m. Eastern Standard. We just came back at the beginning of April. So this is, I believe, like our 3rd show. And we're going to continue doing this every Thursday. All right. All right, so this is MedSurg for 2 or Adult Health for 200. The nurse is evaluating fluid resuscitation attempts in the burn client. Which finding indicates adequate fluid resuscitation? 1, disorientation to time only. 2, heart rate of 95 beats per minute. 3, +1 palpable peripheral pulses. Or 4, urine output of 30 milliliters over the past 2 hours. What is our answer? I'm saying 4s. I'm saying 2s. All right. Let's look at our client situation with the questions asking. We have a burn client. All right. So the situations that the nurse is evaluating fluid resuscitation attempts on that burn client. All right. We're trying to find the finding that would indicate that fluid resuscitation was adequate. So which of these findings would indicate adequate fluid resuscitation? What does that even mean? I'm seeing 2s and 4s. I see a 3. Let's see what that answer is. All right. What is 2? Heart rate of 95 beats per minute. You know we're going to break this down. Let me see who first person to get this answer. Shay Kelly. Shay Kelly's the first person. You already have 700 points. You just got another 200. Ooh, now you're at 900. You're so close to the 1,000 point club. You're so close. All right, so let's break this down. So when fluid resuscitation is adequate, the heart should be less than 120 beats per minute, as indicated in option 2. Okay. In addition, adequacy of fluid volume resuscitation can be evaluated by determining if urine output is at least 30 mils per hour. All right. Peripheral pulses are 2+ or better, and the client is oriented to client, place, and time. So this is what I mean when I say pay attention to the descriptive words or the clues within either the question or the answer choices, because that's going to be the key thing between the answer being right or the answer being wrong. All right. In this case, urine output of 30 mils over the past 2 hours. A lot of people will stop at 30 mils because when you think about minimum urine output, you think about 30 milliliters, but you have to remember there's 30 mils per hour. And this says over the past 2 hours. So that last part was the key. And little strategy hint, whenever you have your clues in the answer choices, make sure you are reading the entire thing. You're not just stopping halfway through, because strategically, the NCLEX is known to put the main meat of the question or the answer choice at the end of the answer option, just to psychologically make sure that you are not missing any details. And they do that on purpose to make sure that they are testing or they're trying to assess whether or not you are paying attention to details in test form, just like you should be doing in real life. Okay. Wait, it's 4 is wrong because it hasn't changed. Correct. So it's what is 2? Heart rate over this. Did I give the points? I did. All right. So great job, guys. At least now you know what that is, what the other signs of adequate fluid volume are. Okay. Now let's do another pharmacology. Actually, no, I lied. Which one do we want to do? Nope, let's do this. Let's do fundamentals for 400. Because I wanted you to have this type of question. Yay, I'm glad that I knew that was going to pop off. All right, so fundamentals for 400. The nurse provides instructions to a client who is scheduled for an electroencephalogram. What is that? What is that abbreviation and what is that? Which statement by the client indicates a need for further reduction? Reduction, what? A need for further instruction, sorry. The test will take between 4 to 5 minutes and 2 hours. My hair should be washed the evening before the test. Cola, tea, and coffee are restricted on the day of the test. or all medications need to be withheld on the day of the test? Which statement by the client indicates the need for further instruction? All right, little NCLEX tip here. Whenever you see that end of the question be a need for further instruction, please remember that you are looking for the wrong answer. If that client needs further instruction, that means whatever they're saying is wrong. So you're looking for the statement that is incorrect. All right. I'm seeing twos, threes. Remember, this is just a multiple choice. This is not select all that applies. So only one answer. I see 4, I see 2, I see 3. All right. Let's look and see what our answer is. I'm seeing answers all over the place. I see literally 1, 2, 3, and 4. But the answer is 4. Who got that? Khadijah got 4. Khadijah on Instagram. Great job, Khadijah. Khadijah. What's this? 400. Great job. All right. So let's break this down. Okay. So electroencephalogram. That's an EEG. Okay. What is an EEG? Break that down. All right, so the client is informed that the test will take 45 minutes to 2 hours and that medications usually are not withheld before the test unless specifically prescribed. Now, pre-procedural instructions include informing that the procedure is painless. And once again, an EEG. Do you guys know what an EEG is? Not to be confused with an ECG or an EKG. EEG is when they record brain activity or the electrical activity in the brain. Okay, so they have the probes on your skull, on your head. Okay, completely painless. It's very important to know because that's a patient teaching hot topic or hot point. Who said I overlooked further teaching, which is why I put this in here. Okay. So yes, medications are not usually withheld before the test. Okay, just think about stickers and some wires here. Think about like what an EKG is for the heart, an EEG is for the brain. All right. Cola, tea, and coffee, those are stimulants. Okay, they need to be restricted on the morning of the test. Okay, they will cause spikes. Just like I said, compare it to like an EKG for your heart, but for your brain. Stimulants when you're trying to test electrical activity is going to skew results, you know? The hair should be washed the evening before the test, and gels, hairsprays, and lotions should be avoided because, again, those stickers are going in your head. So if you have hair, that's going to be a thing. Now I'm going to ask this because I feel like I believe this was a question because it happens in real life. But if somebody had a wig on, would they be able to have an EEG? If someone had a sew-in in, would they be able to have an EEG? No. And I say this from personal experience. Did I know I was about to have an EEG? Absolutely not. Was it the evening after I got a fresh install? Yes, it was. Yes, it was. Did I waste $800? Yes, I did. But yes, no, you cannot. They have to have access to your skull, and a cap will not do it. Mm-mm. So yes, the more you know. All right. Last question. I'm gonna let you guys choose the category and the question amount for our last question. Again, we do this every Thursday, so we're going to be back next Thursday, the 23rd at 7 p.m. Eastern Standard. But let me know what you want our final question to be. Do you want it to be a 500 pointer? Do you want it to be a specific category? Let me know. I love spending these hours with you guys and just going over fun NCLEX things. All right, go ahead and pick a category and or number amount. All right, let's do mental health for 5. And it is another select all apply. Oh, this is a good one because you definitely need to know this. The nurse is preparing to perform an admission assessment on a client with a diagnosis of bulimia nervosa. Which assessment findings should the nurse expect to note? Select all that apply. 1, dental decay. 2, moist, oily skin. 3, loss of tooth enamel. 4, electrolyte imbalances. 5, body weight well below ideal range. Select all. What is our answer? Let's see. I see a 1, 2, 3, and 4. Where are you guys with your answers? Remember, we're looking for the assessment findings. Our client has bulimia nervosa. The situations that there were, as the nurse were performing an admission assessment. So we're looking, question-wise, we're looking for the assessment findings that are consistent with a client with bulimia nervosa. Okay, so those signs, symptoms, assessment findings that you expect to see on a physical examination or assessment. I see 1, 3, 4, 1, 2, 3, 4, 3, 4, 2, 4, 5, 1, 3, 4, 5. Okay. All right. When it comes to mental health and bulimia nervosa, any NCLEX, a lot of NCLEX questions, you're going to be dealing with opposites, whether that's opposite signs and symptoms or even opposite disorders. This is a case of opposite disorders, like just to be aware of. But like usually the disorders have an opposite, so you won't be confused with the signs and symptoms of that opposite. Very popular amongst like select all that apply questions. In this case, bulimia is not to be confused with anorexia. Okay, so you're expect to note stuff. Okay, let's just get into what the answers are. We'll get into that later. 1, 3, and 4. Let me see who's got that. Who said 1, 3, and 4? 1. Esther, I see you. Shay Kelly got that first, actually. Shay Kelly, this was 900. You already had 900. This was what, 500? Yes. So you now have 1,400 points. You are well past the 1,000-point threshold. Congratulations. We're going to get into that a little later. Let's break this down first. All right. So the answer is 1, 3, and 4. 1, dental decay. It says clients with bulimia nervosa initially may not appear to be physically or emotionally ill. All right. First of all, what is bulimia nervosa? What is, give me like a very short summary, like in very few words. How would you summarize or how would you describe what bulimia nervosa is? Especially differentiating it from anorexia. There we go. Bulimia is binge, then purge. Binge eating. Think about those B's. Bulimia equals binge. I'm a person that I like assimilation. All right. Binge, then purge. So they are often they are often at or slightly below ideal body weight. On further inspection, a client exhibits dental decay or loss of tooth enamel because of that induced vomiting, that's that purging. All right, so binging, that binge and purge thing is that binging, they will eat a whole lot of food, okay, and then purge, vomit it back out, like induced vomiting. So like those calories don't stick, if that makes sense. And that's a very big topic in mental health because of the whole body weight and body image correlation, not to mention the physical aspects of it, okay? Electrolyte imbalances from the vomiting. Oh, y'all already know where I'm going to go with this. When it comes to excessive vomiting, which acid-base imbalance would you expect to see with someone with excessive vomiting? Mm-hmm. Was that thank the pit? No, for real. No, for real, thank the pit. Because that's what we did our TV scrub club on. Vomiting causes what acid base imbalance? Is it going to be respiratory or metabolic? Metabolic, and that vomiting. Alkalosis. Alkalosis. Okay, for the people that are here, right, alk. For the people that are here, if you're not in camp nursing school, first of all, you're missing out because everyone in camp nursing school got this question correct. See, just so you don't think I'm lying. Boom, alkalosis. Alkalosis. I know you're in it, but yes. So when you're thinking about alkalosis or vomiting, if you think about the sound that you make when you're vomiting, like that's how you correlate alkalosis. Like it sounds like alk sounds like the sound that you make when you're vomiting, like a metabolic alkalosis. I can never forget it now. So now anytime I'm trying to think about that, right, exactly, metabolic alkalosis. Thank you so much, Shania, for coming up with that and teaching that to us in camp nursing school. But that's a great way to remember it. I will never forget it now. But yes. And then dry, scaly skin rather than moist, oily skin is present. So do you see what I mean? This last line right here, do you see what I mean by always know your opposites? Because more than likely they're going to give you the opposite of whatever is true to try to throw you off to see if you know your comprehension. So the answer is, so for this, they gave you moist, oily skin. Whenever you see descriptive words like this, moist, especially like moist, always think about like, okay, is that the answer or are they trying to trick me and the answer is really dry? Always think about the opposite, because in this case right here, it's true. Case in point, the answer should be dry, scaly skin, not moist, oily skin. So this is what I mean when I say always pay attention to the descriptive words, because those can be your clue as well to at least alert you like, okay, this could be something that I need to take a second look at, because what's the opposite of this? Let me think about that. But yeah, that dry, scaly skin comes from the fact that dehydration is coming from, thank you so much, Bovana, dehydration from that forced and induced vomiting, okay? So you see how everything kind of connects? We said you can never forget that one, right? Bhavana said, I won't forget that now. Exactly. You will not forget that. That's what I love about camp nursing school and all of our meetings and study sessions. It's just like a study group with a very like intimate amount of people that are serious about learning and wanting to learn and supporting each other. And we just come up with ways with, guidance by me. We come up with ways to remember and have these things stick to our brains while I do the active recall part of it. Okay. So this was an example of our active recall, little fun exercises. This concludes this week's episode of NCLEX Jeopardy. Again, we do this every Thursday at 7 p.m. from 7 p.m. to 8. We play some questions in these categories. This was the best study group ever. Period. We do these categories every Thursday. Like I said in the beginning, we may switch up some of them, like the pharmacology, so it could be dosage calc, the maternity, so that it's pediatrics. We just do like a very healthy combination, but it's a great way to actively recall all the things you're either learning that day in class. I have several comments of people saying, oh my gosh, I studied this in class today, or I have a test that I needed to prep for. So this was great prep. And it's fun. Like, we come up with fun little acronyms, mnemonics, we're laughing. Like, it's who else can I come up with like fun study tips and mnemonics for that's related to like Real Housewives of Atlanta? Who else can I do that with? Only you guys. So yes, we do this every Thursday. So make sure you come back next Thursday. And for those of you that are in Camp Nursing School, remember on Tuesdays we do our Q&A. That's like our office hours, our live support. So if you come in with questions about either a topic or just you need someone to talk to, think of it, like I said, as that a live weekly support office hours. So if you need that and you're not in Camp Nursing School, we do that every Tuesday, 7 p.m. to 8 p.m. First come, first serve. Not even first come, first serve. If you come in, you come in. Those are the office hours, right? So if you have any other questions, y'all know where to find me. The winner of this week's NCLEX Jeopardy was Shay Kelly. Where are you, Shay? Woohoo! Congratulations. Shay Kelly, you have won a free complete nursing school study system. And that contains everything that you need to succeed, honestly, from study guides galore that are related to pop culture and very easy to remember, full of those must-know content topics, to active recall worksheets, templates, the things that you need in order to pull that information from your brain so that you really burn it into your memory for long-term retention and faster recall when you need it on exams, on quizzes, on homeworks. Those are the things, the tools that are within the complete nursing school study system. So I'm so excited for you to check that out. Please make sure you let me know how you are loving it. Where is she? I think it was Sophia earlier said that she bought last week and she's loving hers. So Shay Kelly, please send me a message. Functional. Okay, please send me a message with your email address so I can go ahead and give that study system to you. You're going to get an email with the link, and that's going to be your access link. You're going to bookmark that. So that's going to be a whole bunch of content in one. So I'm very excited for you. You can choose what you need when you need it. And that's what I love about the system. It's not just one big, huge PDF. It's a bunch of PDFs. I can't say little. It's a bunch of PDFs inside, some videos, worksheets, planners, all fun stuff that you need, like I said, to succeed. Thank you guys so much for joining, and I will see you next week. Shay Kelly, congrats again, and I'll see you guys next week.